In 3, 2, 1.
Welcome to the Better Than Yesterday Everyday Podcast, where we cover anything related to behavior change that will increase your long-term wellness and happiness. And now, here are your hosts, personal trainer and RNs, Matt and Jenna.
What is happening, everybody? Welcome back to the Better Than Yesterday Everyday Podcast. My name is Matt.
And I'm Jenna.
And today, we finally feel ready to talk about this hot topic button, the coronavirus. We did not want to talk about this without qualified people being here. They just happen to be our friends. Thank you both so much for coming on. Who are you? Tell them who you are.
I am Dr.Coley. I'm one of the anesthesia intensivists at Sacred Heart here in Pensacola. So I'm a board-certified critical care physician, and I'm board-certified in anesthesiology. I've been practicing for about 20 years now.
My qualifications aren't quite like Chris. I'm a Jerry drinker. I'm a family nurse practitioner for 24 years.
Okay.
Yeah,
So,
that's more than qualified.
Yes, both highly
years
qualified.
of nursing experience.
Yeah, both highly qualified. I worked with Dr. Coley in the ICU when I was in the ICU. We've known each other for quite some time now. If you're new to this podcast, we are all about implementing behavior change for your long-term wellness and happiness. And my gosh, at a time right now with the coronavirus, that couldn't be more evident that that's how it should be. If you are listening to this podcast on iTunes, Google Play, Spotify, all of those major platforms, you can watch this at the thebtyepodcast on YouTube. And I will put a link down below so you can check that out because, yes, there's a visual to this. You can see these beautiful faces. At the top of every show, we hit you with our gratitude point. This gratitude point is something that hopefully will shift your perspective in times where you feel down, when there is not things to be thankful for. There really is, if you can reach for this gratitude point. And I'll let you go first because it feels like I've been going first a lot lately.
Yeah. Sure.
All right.
No, I think we take for granted how quickly we get our information, how easily our information is accessible, regardless of whether that's accurate or inaccurate information. But I think, being able to have the information that we have available to us so quickly is a really great advantage.
Yeah.
And I'm grateful for that.
It's true. It's true. But if you have really intelligent friends, that also really helps just to shoot a text to know if you know what you're actually talking about. I'd have to say that my gratitude point is knowing that I have time. I'm 30 years old and I'm still young, and I know that I've questioned if I'm moving quick enough, if I'm learning quick enough, if I'm progressing quick enough, and there's still time. But at the same time, if you remain stagnant, time can burn right by. But I'm appreciative of the time that I do have ahead of me. So boys, if you have a gratitude point, hit us with it. If you don't, it's okay. We can move on. Putting you on the spot.
Well, obviously, at this point in time, I'm grateful for and appreciative of my health, right? I mean, that's something that we're all right now worried about, and the health of not ourselves only, but of the others around us. I'm thankful and grateful for the health of myself and my family at this point.
Yeah.
I'd probably have to say that I'm just grateful for the health care that we all do have available.
There you go.
We're in an area where we're very fortunate. We're unfortunate to be dealing with this right now, but we're also fortunate to have the resources that we have.
That's true.
1,000%. And, we did want to mention that we want to stay as far away from politics in this as we possibly can. We truly want to just present look at me touching my face. We truly would just want to present the medical facts and what we understand. And, we actually already had one comment saying, be careful of what you listen to out there. And it was about actually this podcast. It was a post and somebody said, be careful of what you listen to. And I fully agree with that comment. We're presenting what we understand. The only reason that we are having this podcast is because we know that Chris and Jerry are highly qualified, and we trust what they say. We know that they are updated on all of the information from the CDC and the leading information. And that's actually going to be one of the questions that we have for you. But, starting out, I think it makes the most sense to sort of talk about the coronavirus and all the hype. Can we narrow down what it actually is? What the heck is the coronavirus?
And sure, let me just jump back to
Sure,
what you just
sure,
commented
sure.
on as well. I think that's really important for everyone listening out there to be sure they're verifying the sources and where they're getting the information. I actually saw that comment, and I couldn't have agreed with the individual that posted it more.
Yep.
We need to be very cautious about where we're consuming this information. And what we're talking about today is the information as we understand it today. This is a rapidly changing situation, and what we talk about today may be very different a few days or a week from now. And so we all need to be vigilant and aware and stay up to date. And so, yeah, we're happy to discuss these things, but I do think you have some very informed listeners out there, and they need to be aware of where they're consuming their information.
Yep.
So, what is this virus? So it is a coronavirus. Corona simply refers to the shape of the virus. We've all probably seen the photos of this circulating around with the nice little red spikes all around it, and a crown appearance that allows this type of virus to infect our cells. What's really unique about this specific strain is we haven't seen it in the human population before. So our bodies have no recognition of this from past exposures. There's no immunity that any of us have to this. And it appears to be very highly contagious. So when we've seen other outbreaks in the past, some of these things have been really deadly, and so they do infect a lot of people, but they die pretty quickly, and so we don't have time for it to spread throughout the world, throughout large populations, like we're seeing this. So this is a very deadly virus. It's very contagious, but not to the degree that some of the more severe epidemics we've seen in the past have been. And so this has spread quickly around the world and infecting a large number of people, and we know there are certain subsets of the population that are greater risk for complications than others.
Yeah. Okay. That makes sense.
And I see a lot of people comparing flu cases and flu deaths to the coronavirus deaths. Why is that not a good idea?
Well, I mean, first of all, it's a totally different type of virus. And as I've said earlier, our bodies have not seen this before. And I think it's really early for us to know actually what the mortality or what the death rate from this is going to pan out to be. In
the long run,
in the long run,
sure.
Yeah. And so we know from early data that this is, some estimates have been up as high as 3 to 4% range. And when you're talking about flu deaths, most of those are less than 1%. So we know that the mortality rate from this, at least in the early studies, have been higher. One of the confounding factors there is that we don't know how many people have this virus that haven't been tested. And so for everyone that we have tested that we know has this, there may be many others out in the population that are either not sick enough to require hospitalization or they have not sought out a test. And so these numbers may be skewed, and we may be seeing a slightly higher mortality rate than the reality of this once we get a better handle of how many people in the population actually are infected with this virus.
Yeah, okay. Good point. So I did some Facebook investigation and found some advice
Facebook, right?
circulating. Yes, that's where some people get all of their medical knowledge. So I just wanted to clarify some common advice that I saw on Facebook. One was saying that the virus is not heat resistant, so to drink some hot water. Does that seem to be
that is not effective? If it was effective, we'd be drinking hot water all around the world right now, not seeing these big outbreaks. I know that is not effective.
Another common one I saw was to drink water every 15 minutes to clear your throat of the virus.
Yeah, also not effective. It's very important that we stay hydrated just in general, and we talk about that for general health, but to actually flush out the virus, it is not effective.
And then the other one, of course, was the saltwater gargle.
Yeah. Again, there's no evidence, nothing to show that salt water or any type of solution that we gargle, whether it's I've seen salt water, I've seen mouthwash, will actually kill the virus. So good hygiene is important. Staying hydrated is important, but there's nothing that we know of that we can actually drink to cure or kill the virus.
Well, and like you said, like all four of us were talking about it before we actually hopped on the mics, and I forget, Jerry, if you said it or Chris, you said it, that if something that basic was already being done, it would be all over the place, and it would be a well-known thing that is what's fixing this. So that makes total sense.
So then what is being done generally to treat this virus if you think you might have it?
That's a very good question. So, I mean, there's several things. So, I mean, that's a few questions packed into one there. And so if you think you have it, what do you do? And so that's a fear, I think, right now, because it's not only coronavirus that we're seeing in the communities. I mean, even here in this area, we've, seen flu cases late in the seasons. There's flu cases all around the country right now that can mimic this. There's seasonal allergies. Everything is blooming right now. So a lot of people are having allergy type symptoms. that can be very confusing. So people are afraid, they're fearful, and they want to be tested for the coronavirus. So first of all, it's important that we watch daily, check on the CDC website, see what the latest recommendations are. But as of right now, the recommendation is that if you're having mild symptoms and not in distress, call your healthcare provider, call your primary healthcare provider. And if they deem necessary for you to have a test, they will direct you to one of the centers in the area where you can actually obtain the test. There are several ways that we can get tested in this area. There is a drive-through location that's opened as of today at Ascension Sacred Heart in Pensacola, but you have to have an order, but you can't just show up there and get the test.
And you know what, I think what we'll do is I'll plug that down in the description below. If you're out there and you're listening and wondering, I'll put that down.
And it seems like those have kind of popped up all over. I know I'm from Ohio originally, and I still get a lot of notifications from that area. And there's a couple that have opened there too. I think it's a great idea.
Well, and again, trying to stay away from the politics, but I think it makes sense to sort of touch on the amount of what feels like absolute panic. You know, I know that, like you said, you've been around for a long time. I saw H1N1, and I just don't remember there being this much what feels to be chaos. Any idea why that may be?
Well, I think now, as Jenna alluded to earlier, we have access to information really quick, and sometimes that's really good. It actually helps us with a lot of, public health planning and managing some of these different type of disasters that we can see throughout the world. But it also can be detrimental because it's overwhelming. And so as we're consuming all of this information every day, it's inducing stress. And it's something that we can all see coming at us, and we're continually afraid of it. But there's nothing that we can, I shouldn't say there's nothing we can do. We feel powerless in the situation, but we're really not.
Yeah, if you feel like you need to do something.
Right, you feel like you need to do something. You're going to the grocery store and you're seeing the empty shelves, the empty aisles, and you're thinking, oh my gosh, we're not going to have enough, food to feed our family next week. We're not going to have, toilet paper, whatever it is that it may be out of in your area. So I think we are seeing, a little bit of panic right now. And I think we all should, take a deep breath and, try to be calm in this situation and think about, be positive, think about the things that you can do. So some of those things are a little out of our control, but there are things that we can do to protect ourselves and our family. And, in general, as we discussed before the show, I think we have to start changing our mindset a little bit from protecting ourselves to what are we going to do to protect society, to protect our friends and our family, to move from this mentality of what can we do to just stop ourselves from getting, of how can we contribute to minimize the spread of this in our communities.
Yep.
So, and let's talk about that. So the common thing, of course, to prevent yourself from getting sick is wash your hands, don't touch your face. Are there any other recommendations that our listeners and watchers can be doing?
That's been a common question.
Yeah, of course. So, still hand washing is probably the number one thing that we can do, and proper hand washing. There's tons of questions out there about how do you wash your hands? What do you wash your hands with? Do you need antibacterial soap? We've seen that fly off the shelves everywhere, and it's even hard getting it online now. And that's not really necessary. The antibacterial soaps are designed for bacteria, not for viruses. This is a virus.
What a great point.
And that's this.
Thank you for bringing that up.
So regular, good old-fashioned soap and water will do a great job. The key is washing your hands for the appropriate time, which is at least 20 seconds, and you want to use a vigorous scrub under warm running water, and good old-fashioned soap will do the job there. And that's probably the number one thing that we can do. For more than that, trying to maintain as healthy of a lifestyle as possible. And again, we kind of touched base on this before.
Yeah.
All the things we see going off the shelves, there's still lots of fruits and vegetables in the grocery stores, right? And that's some things that we can do to try to maintain our health by eating foods that are high in antioxidants, high in vitamin C, things to necessarily try to help boost our immunity so we can fight off things naturally ourselves. And then I think taking it a step further is if you feel ill or feel sick at all, isolate yourself. Don't go out in the public. Don't go out and expose others. So the minute that you start feeling sick, stay at home. And if you have a known family member, as the newest recommendations, if you have a known family member in the same household with coronavirus, then the entire household needs to isolate for 14 days.
Okay. See, I did not realize that. And so there was specific questions about what are those symptoms themselves. And is it, correct me if I'm wrong, isn't it temperature, cough, and any signs of shortness of breath? Are those the three main?
Those are the top three, yes. But there are many people out there that may have minimal symptoms or no symptoms at all, and that's one of the things that's concerning. And as I was on our way over here for the podcast, I was actually watching an interview with someone off the Diamond Princess cruise ship that her and her husband were both diagnosed with coronavirus, and neither had symptoms, which drives home the importance of social isolation in this setting. So we all say, why is it important that we stay away? Why do we shut down restaurants? Why do we not go out in groups? What?
Moth just got in the studio. That's professional. Go ahead.
So what is important? And it is because you can have minor symptoms or be asymptomatic and still be transmitting this to other people that are vulnerable in our community.
Yeah.
But for those of you who are wondering, the most common symptoms are going to be cough, fever, and in fact, in some of the reports out of China, in the hospitalized patient group, up to 90% of them had fever within 24 hours of presenting and being admitted in the hospital. So we're not capturing all of that group that's never making it into the hospital that may have milder symptoms, but fever and cough are very common symptoms. GI complaints, very low on the list. I saw that on some of the questions.
Okay.
I got some on Facebook.
So no need to hoard the toilet paper.
No need to hoard the toilet paper. A low number of patients may have GI complaints with this virus, but it's on the lower end.
Yeah, I think that's a key differentiation between right now with it being allergy season, is that if you have a cough, it might just be your allergies, but if you have a fever, that's maybe when you should be differentiating the two. I think that's a good point of the social isolation. You're not just protecting yourself, you're protecting others because you might have been exposed to it and you don't know.
Correct.
So I think that's a good point that you've brought up I didn't think about before.
So, Jerry, this is a question for you because, I mean, being in family medicine, I think this kind of pertains to you. So I've had the question directly to me, and I've seen it everywhere on Facebook, you know, when is it time to stop going to the gym or to start working out at home? I can, of course, you know, answer the piece about how to do the actual workout, but at what point is it? Because a lot of gyms around the country, and I would imagine around the world, are shutting down. What do you think? Is it time to stop going to the gym?
I think it's time.
And why?
Well, we just saw the recent CDC recommendations of the groups of 10 or less. And it's rare that you're going to walk into a gym that has 10 or less people, a classroom, a grocery store. So I think people need to be just aware of where you're going into. You know, we know that how the virus is shed is not only shed in sputum, it's also in blood, feces now. So you have to be aware of, you know, public restrooms.
Okay.
So I think now's the time.
Okay.
Yeah. And I think the point to that is that doesn't mean you have to shut yourself in the house. You can still be outside. You can still be active. You're just supposed to be isolating yourself
socially. These are for
socially.
people who are like actively shedding the virus, that we can find it in these different samples. And we know that while you're actively shedding, then you can be. So it's not that you're going to catch this routinely from anybody that's out there. It's for people who are actively infected. And as we just pointed out, we don't know who those patients are right now.
And assuming that you're not actively infected, like we're just talking about the gym, because you just sort of touched on it, Jenna, that you don't want to just isolate yourself in your house indefinitely, because that's no way to live your life. But, you know, if you can exclude, you know, if you go to the grocery store 5 times a week, maybe lessen that down to once or twice a week, you know, just be smarter with your travel and, you know, picking and choosing where you're going. Is that what you're saying?
Yes.
Yeah.
And I'm guilty. Like, social distancing is hard for me.
Yeah.
And so I know as this progresses and over the next few weeks, it's going to be more difficult, and we're going to have to be a lot more cognizant of what we're doing. And so I think through all of this, we have to maintain some type of mental stability, mental clarity in order to be aware of our surroundings. So like you were saying, going outside, that's one of the best things we can do.
Yeah.
Yeah.
What was it that you were talking about? Remember you were telling me about the open windows and all that way back in the day?
Oh, yeah. Before antibiotics, that's why the old hospitals had all the high windows and that opened, because they thought that there was disinfecting properties in fresh air and sunlight. And I guess there were some starts of some studies, but then we discovered antibiotics. So then no one continued those studies. So
that's pretty cool.
I read that and then I went outside.
So I want to start reading a few questions. Footless Joe, she's actually been on this podcast. We love her to death. She said, how can we best help or communicate with our doctors as patients if someone feels they might be coming down with something like the coronavirus? What is the next best step? Go to the doc, call ER, stay home. You know, I think we touched on that, but like, do you think it starts with a phone call to the doc?
It starts with a phone call. And that's really important because not only if you think you have it, are you going to expose everyone in the doctor's office?
Yeah.
And then if their staff is exposed, they will not be available to take care of patients with other conditions that we still are going to be seeing in the healthcare system throughout this entire crisis. And if it's not something that you'd normally go to the doctor for, I don't think you need to rush out to the doctor now because you think you have coronavirus.
Okay.
I mean, I think that's one of the things that we all need to keep in mind. If we have some mild allergy type symptoms, it is wise to stay away from other people. In case you don't know, kind of keep yourself at home, take care of yourself, but don't rush immediately to your doctor's office or to the nearest emergency department. Obviously, if you're having more severe symptoms, shortness of breath, high fevers, then you do want to be evaluated for that. And whether that's a phone call and your physician directing you where he would like you to go from there, or if it's again, shortness of breath or something that is very different from your usual when you have a cold, then you might want to even go to the nearest emergency department if you're having severe shortness of breath. I don't want to direct anybody away from that if they need that care.
Yeah. Yeah, that makes sense. So, I mean, as much common sense as possible. But and I think that's the big point. So Jenna and I work at a hospital here in town, and that's been the big thing that they're saying, like, if you flood the ERs, if you flood the doctor's office, they, like you just said, we can't effectively treat everybody, especially the people that need to be treated. So, so there was another question that was asked: will petting my cat that goes outside put me at risk of catching the virus?
So no, it's not going to put you at risk of catching the virus. However, interesting enough, and I did read through the latest CDC guidelines on the way over here, and they recommend if you have the virus that you avoid petting your animals.
Okay.
And have someone else in your household care for that if you can. I think it's not clear. I don't think that the animals are transmitting this to us, but just like we don't know how long this particular virus lives on different types of surfaces, we also don't know if it lives on the pet for a period of time. And that can be a means of cross-contamination if that pet is going to other members of the family. Mm-hmm. So that recommendation on their side, the way I interpret it at least, is primarily for people who are diagnosed with coronavirus and caring for their pets, not just because you happen to have a pet that goes outside. You're not going to just catch this from your pet going outside of the bathroom and coming back in. Okay.
Yeah, and gotcha. that leads perfectly into the next question that Alex asked. Once someone gets and recovers from the coronavirus, how worried do you need to be? Like, what is the possibility of immunity? And I think we were talking about it off the mics. You said, like, do we know yet? Do we truly know?
I think it's too early for us to tell, if you're going to have immunity, and if so, how long that immunity will last. Yeah. We know from other coronaviruses and other types of viruses that we've dealt with that usually we do build an immune response to it, and it's uncommon that you get the same one again, at least in the short run. So there have been some reports out there of people testing positive within, 3 to 5 days of being pronounced that they're cured and taken off isolation. And those are very few. So I don't think we know quite yet how that's going to be. I think, possibly we have to look at those tests and see if there was inaccurate testing and maybe they were released off, their treatment too soon, and we're still shedding the virus, and then they caught that later on. And so we don't quite know is the answer to that question. Yep. But presuming that it behaves similar to other viruses, we should have some immunity to this if we recover from it.
Okay. I'm going to shut my mouth for a minute and let you talk, Jenna.
No, do you have more?
I actually do. I have plenty more. So Carrie asked the question, I understand, washing my hands, working in healthcare, washing my hands, but as to not bring it home to the family, and I think we touched on it, but is there anything else we can be doing besides washing our hands? And I thought, like, what about disinfecting things, like cleaning your phone and those things? I don't know if we've touched on that fully yet.
Well, I mean, I've read some recommendations as far as, basically just making sure you wash your clothes before you bring it in all the way into your house.
That's groundbreaking. Okay.
Yeah. It's just some simple things like that where you you don't think about, you come in, you take your work clothes off, you throw them in the hamper, and what else touches those clothes? What touched your clothes before you took them off? Same thing with your shoes. I think that's just being more cognizant of that.
Yeah, I don't have anything to add. I don't know, Jerry, if you...
Yeah, basically we just had this conversation before we left to come here earlier today because he's going back into the hospital, and what do we do at that point?
Okay.
And so we talked about the disinfection of the shoes before he comes into the house. Just leave them outside in a Clorox bath, basically, a bleach bath.
That's a good idea.
And the scrubs will just go straight to the wash.
Okay. That's a good idea.
Oh, and that brings up a good question. I'm sorry.
And from some of the recommendations, again, I did kind of look over some of this in preparation, and the World Health Organization has their own recommendations. The CDC has their own recommendations. And so a lot of people are asking, can I wash my clothes with other family members? If they have coronavirus, can we mix our laundry?
That's a really
together?
good question.
And so, yeah, as far as we know, that there's no reason not to, but I would be, cautious. Again, use extra, measures. So there's no reason. Wash your clothes, keep them clean. That's the best thing we can do. But if you're doing your laundry and you happen to be caring for somebody, take the extra measures of, washing your hands thoroughly after you put them into the laundry. If you're in healthcare and you're coming home, take the extra measures to do something to sanitize your shoes, leave them outside, or your clothing. And I think those are measures that we've probably all taken at some point, working around infectious disease in the critical care setting throughout our careers.
Yeah, it made sense to do even before the coronavirus. Yeah. And Matt's ADD moment. I think a lot of people don't actually realize that the coronavirus is not brand new. And you touched on that. I want to retouch on that the coronavirus is not brand new. There have been other coronaviruses. This strand is just different. Is that accurate?
Correct. I mean, coronavirus is a general category of viruses, and it refers to the actual shape of the virus and a crown-like shape, which is corona is where that word is derived from. So the way it looks when we look at this under a microscope, it's this particular strain that's different. And so just as we have different types of viruses, rhinovirus, coronavirus, there's the different flu viruses, different strains, and they kind of mutate and change over time. And our bodies, some things we've been exposed to in the past, and our body will recognize it. And when we're exposed to it again, it induces an immune response where we attack that and destroy that organism before it causes detrimental effects in our body. We haven't seen this before. So when our body sees it, we don't quite know why some people have such a massive response to this and others pretty mild. As we kind of touched on, some people are asymptomatic, but we know the older you get and the more problems you have, the more issues that you'll have when you're exposed to this virus. And we don't know quite why yet.
And that's also another good segue. Brianna asked, I work at a daycare, I read more, come on, Matt, spit it out. Children aren't getting sick. I have asthma. I've battled pneumonia a few times in the last 3 years. I'm worried because the preschool environment is notorious for being a germ factory. Should I be overly concerned? Should daycares close along with schools? That's a loaded question.
That is a loaded question. I guess we shouldn't think of our children as germ factories, but we all know that.
Yeah.
It is very difficult to teach kids to do some of the things that we're recommending for the general public, to not touch their face, to not put their hand in the mouth, to not pick things up off the floor, to wash their hands for 20 minutes. All those things are very difficult to get children, especially of the preschool age, to do. Mm-hmm. Also, they're not showing symptoms to the degree that we're seeing in adults. And so they may be carriers are able to transmit this disease to the more vulnerable population that we're not aware of. But in general, we haven't seen the response in children that we see in adults once they get in their 7th and 8th decade of life.
So it doesn't sound like children would be any worse of a carrier or passing it along than anybody else, an adult.
Correct. I don't think that children have some, it's not that they can't get this virus. We're just not seeing the response where they're at this point becoming as critically ill as we're seeing with the older adults, but they could still, in fact, have coronavirus. They could still carry this virus, and they could still transmit it to others, whether it's to the grandparents or parents or people in the daycare setting. Dr. Fauci addressed this very briefly.
If you haven't really been watching the news, Dr. Fauci, he's been like the leading person that's really been talking about the coronavirus, right?
Correct.
Yeah.
And there was just before this podcast, a couple hours ago, he was was in part of a news conference that they had some updated recommendations, and this was a question: should daycares be closing along with schools?
Yeah.
And I don't want to quote him without having it in front of me, but it was a very nuanced answer. And I think what he read from was that basically if it's an impacted area that you're seeing spikes in cases in your area, then that should be strongly considered, which opens a whole host of other things. What do you do with these children?
Yeah.
Where do they go? Who cares for them? Do they have meals provided for them? So it is a loaded question, but it's something we need to think about. And especially if you have providers that are immunocompromised that are working in these centers. They need to reevaluate what they can do to care for themselves in this situation.
Yeah, and not to go too deep into that, but I think you, the listener, if you didn't really catch on to what he's just saying there, let's say that we do close down schools or daycares. A lot of these nurses and doctors and healthcare workers in general, they have kids that are there. So who's going to take care of the kids? They got to go home. So who's taking care of the parents? Not to mention like normal common issues that are already coming through the emergency room doors or coming to the hospital. That isn't going away. Heart attacks, strokes, all the things that hospitals already deal with, that has to be dealt with on top of this influx. So that, you're saying that's a loaded question and a very, very particular to that area. That makes sense.
Mm-hmm. Yeah, I was just thinking about conversely, if your kids still go into daycare and they're getting exposed to the coronavirus and then bringing it home to their parents to then be going to work as essential personnel. I mean, there's pros and cons to both sides of that.
Yeah, without a doubt. What you got over there? You got a whole notebook full of stuff.
I think we've answered a lot of these questions. I think one thing that we haven't touched on is how we know that the social distancing is working, or how long do we need to wait to really be seeing those true results of, is it working?
Probably at least a couple of weeks, right? Because we know that once someone is infected, probably most people will show symptoms within 5 to 7 days, but that period can go all the way up to a few weeks. And so, if we all were to take these measures and be very strict with them across the country start today and maintain these measures, we would hope that we would see an impact on this within 2 weeks. Right now, we have seen a very sharp spike and increase in the number of cases. And so I think it demonstrates that the measures up until this point have not been effective. And so we are seeing drastic measures, things that we've certainly never seen in our lifetime in the U.S. in terms of closures of schools, restaurants closing in certain parts of the country where they're having large numbers of cases. Just in Northern California, I believe earlier today, they're actually asking people to shelter at home in a number of counties there because of the number of cases that they're seeing increase in that area. So they're asking them to shelter in place. And so we may see that move to other parts of the country as these case numbers increase.
Okay.
Yeah, I've seen several areas that are closing restaurants. They're just taking like takeout orders. Mm-hmm. Do you think that's enough? Do you think takeout orders are still going to be risky?
I just talked to a restaurant owner earlier here, a local owner that we know, and he said that's coming to his restaurant, that he predicts that within the next week, that's the service that they'll be providing. And hopefully after that, after a couple of weeks, they'll be back to normal. The other concern is the supply of food.
Yeah. Wow. In my head, I'm just sitting here and I'm just thinking about the social and financial impact that this has. That this has. The NBA is shut down. March Madness is shut down. There's just been so much that's been shut down with good reason. I'm not saying, we need to start it back up because of money, but you just think about how intricate and how detailed and how deep this goes, especially for small business owners of just keeping the doors open. So that's man.
Yeah. Well, and for parents too, you had school for your kids to go to, and now you having to pay for daycare or babysitter for you to go to work if your job is still open. And that's just that whole snowball effect. People are going to be under a lot of stress. Yeah, the next couple of days and weeks.
This has definitely affected businesses and industries throughout the U.S. I mean, on a very small level, we've seen it from our aesthetic practice, where we've actually taken proactive measures to try to do our part with the social distancing, scheduling patients further apart, not taking as many appointments in the day. So we can use extra measures to use germicidals between patients, pre-screening patients at least a couple of times before they come in about their travel, their history. And so, like I said, that's from a really, really small perspective of we have a small business here and it's had that impact. So I can only extrapolate that out and the travel industry is hurting tremendously with this. So it's impacting a lot of areas of society. On the positive note, I don't want this whole podcast to be about doom and gloom, right? So there are things that we can do, and I think we've talked about some of those issues. But if we look at the history of this in China, it's all right now we're getting the brunt of this because we're seeing the spike of cases here in the U.S. But if we look back in December when they just had the first 4 cases reported there and they didn't quite know what that was, and then how this, cases over the month of January and into early February really spiked, and we watched them as the world, we watched over in China as they dealt with this horrible epidemic in that, the area that was hardest hit. And now we're in mid-March and they're closing down the hospitals that were built just a month ago. So they are seeing a sharp decline in their cases. But they did very strict social isolation measures, quarantine measures. They got extremely aggressive with managing these patients and trying to keep this under control.
Okay.
And, a few other the points that I would like to make, before we finish up here, there's a lot of discussion about if most people are going to get this anyway. If we know that over time a lot of people are going to get it, why don't we just let everybody get it and see who will build up their immunity to it and what will happen? The thing is, even if we can delay these cases by a few weeks, the impact that we can have on the actual total number of cases a month and 2 months down the road is tremendous, because we don't want to overwhelm our healthcare systems.
Yeah.
So we have seen that some of these measures have worked in other areas. And I think that as a society, if we all do our part and, view this, that we will get through this. And this is going to be longer than most of us are accustomed to. It's not like a hurricane. It's coming at us quick. We don't have a lot of time to prepare for it, so we get nervous. We see this anxiety and this panic for a few days, but then the event is done and it's over. Yeah. And we all kind of recover and rebuild and try to get our lives back on track. This event, we've watched it coming for months now. We have this built up anxiety, this fear of what's coming, and now we're seeing this slow increase in numbers. And so we're going to see that increase as we do more testing. We are going to see those numbers increase. I mean, I think we should all just prepare for that and expect it, but we don't want to overwhelm our healthcare system. So if we can delay these cases, the longer we can delay it, the more chance that we'll have effective either antiviral treatment. Vaccines are still a long ways off for this, but we may have more treatment options, and we won't have all these patients flooding into our healthcare system at once. You
bring up a good point that just because we're seeing a spike in number of confirmed cases, just because we're testing more.
Yeah. That's a really good point. And it's knowing that this is not the peak, I think it's a good thing to adopt. And I think that helps bring down some of that panic, even though nothing's really been fixed, but to know it's going to get a little bit darker before it gets light. But you're right. I think keeping that positive mindset. And again, I keep fumbling through questions here. And you touched on this in the beginning, that I thought that this was airborne in the beginning. And that was the question. Gregor said, is the virus, does it linger in the air for extended periods of time, like I've read? Does this apply to outdoors? So does it linger in the air for 2 hours or whatever?
That's also really interesting, and there's a lot of factors that go into that. Temperature, humidity. And so we know that with other viruses, and we look at flu viruses, most of those, if we've been in healthcare for any period of time, we've used droplet precautions for all of that. And so in more humid situations, a lot of these things tend to be weighted down and fall to the ground. So if we cough, if we sneeze, a lot of those particles go down to the ground. Whereas if you're in a really cold, dry climate and you're coughing a lot, then some of those particles can live in there. I don't know the answer to how long. I don't think anybody can tell you that for certain.
Yeah.
But I think that one of the things that we do know and that we are aware of right now is that things that we're doing in healthcare, things that we're doing in our emergency departments and our intensive care units, where we're having to induce aerosols, that it's more likely that it's going to be within a certain distance of that patient in the air for a little period of time. And so we are using N95 masks, and we are using airborne precautions for aerosol generating procedures such as intubations or bronchoscopies, where we're doing washings, things that we're going to be inducing a lot of cough and sputum, and the viral particles are going to be in the air. Other than that, the whole discussion about what's appropriate personal protective equipment, I think if we had an unlimited supply of N95 masks, we would probably all feel better if we put those on. But there's a lot of,
it goes even deeper than that right there too. So, and if you're unaware what an N95 mask is, it's a very occlusive mask that's used in a hospital setting typically, but I know it's also used in, if you, I know if you work around a lot of dust and you don't want to get particles in your lungs, but all the years that all four of us have used them, it's a very occlusive mask. It's a very tight fit. and it's the best.
And you have to go through a testing process.
You have to go through a test
to make sure. Yep.
It's like you can't, like, I have a little bit of facial hair right now. I probably wouldn't pass it. Like it's very particular. And I think that, a lot of people ordered these up off of Amazon. They bought them from everywhere, and it's actually difficult for healthcare systems to get their hands on them. And I just don't, like, it's not like you're going to pick that N95 mask up and everything's fine. Same thing goes with the surgical mask, which is that very simple mask. It's got the little loops that go around your ears. That probably does next to nothing.
Well, it was really, really fascinating. A couple of weeks ago, when all of this was just starting to ramp up, we were in New York teaching a class. And on the flight home, of course, people were starting to talk about this. We were seeing more masks on the airplanes. And it was fascinating to watch everyone on the plane with a mask and how much they touch their face more.
Yep.
And the problem is the mask can get contaminated with anything on it as well. And they're pulling the mask down to drink from the flight attendant. They're eating under the mask, putting their hands under there. So they're touching their mask and then touching their face. And so your actual risk of contamination, if they're not used properly, is probably even higher from the constant adjusting and touching on your face. Yeah. And so it's not used or recommended for healthy people that are not showing symptoms for that reason alone. It's not like the masks themselves have something dangerous with them, but people tend to not use them properly, especially if they're not trained in the proper use.
Yep.
Yeah.
Makes sense. That's such a segue into, this podcast is all about implementing behavior change for your long-term wellness and happiness. And that right there is just, I think the question still lies, well, then what do we do if the masks don't work? And, okay, we isolate ourselves. Then it still goes back to, washing your hands. It's that behavior change piece. And I want to ask each of you individually, and Jenna, I'll start with you. What is one thing that you think we could do behavior change wise to positively impact this situation? Because I think it's one thing to look at a governing body, but what is one thing that you, the listener or the viewer, can do?
Something that impacted me today looking through all the information is the people who are being released from quarantine in China. There's a light at the end of the tunnel. Like, people are being released. They're recovering. They're doing well. This isn't all doom and gloom. We're all not going to get sick. This is a very serious thing that's happening, but people are making it through it. And I think that's a great thing of us not being the first country to be impacted, is that we're watching, a couple months down the road from our standpoint, what's going to happen.
Yeah. So
to look for the good, with all of this negativity. I mean, we spent 42 minutes and 18 seconds talking about mostly negative things. There is positive. I mean, there's things that you can do on a daily basis, I think, to impact people, not panicking, looking for the good of, hey, I already have a couple packs of toilet paper at home. This person over here probably needs some. I'm not going to take it all from the store. Being mindful and looking for the good. I think there's always good that you can find.
Yeah. Jerry, what do you think?
I think it's she said it perfectly. One of the main things is to be able to maintain some type of mental clarity through this.
Yeah.
Because everywhere we turn, whether we turn on the radio, we look on YouTube, we look on our Facebook. It was fun at one point, and it was all good. We looked to see what our families were doing, and now we look and we see, just chaos.
Yeah.
Mm-hmm. And so I think finding your spot, find your place, find what relieves your anxiety so that you can maintain enough sense about yourself that you're not putting yourself in danger or putting yourself in danger, whether it's meditation or exercise or yoga, or you mentioned fresh air.
Yeah.
Mm-hmm.
It does us good.
Yeah, it really does.
You're just singing praises right now. I love everything of what you're saying, Jerry. Right up my alley. Chris, what do you think?
Yeah, I mean, for me, any of you guys that are listening that know me or Jerry, we love travel. We travel extensively, and we have altered that. We've canceled all of our travel for the near future. Yeah. Which, is a bit anxiety provoking in and of itself. But I think that's given us a chance then to refocus on some of the things that we can do here and some of the things that we enjoy that maybe necessarily doesn't involve as high-risk activities. I was out working, and gardening planting plants today, enjoying some fresh air, being outside, but away from people. And this is a temporary thing. I realize that, and I think it's important for us all to realize as a society what we can do. It's a very serious topic, and it does seem, doom and gloom for all these minutes that we've talked about it. And I would like people to take this very seriously. I feel that certain pockets of our country have not taken this seriously until now, and we're seeing some of that. But it's, refocus. See what we can do. Whether, again, Jerry mentioned meditation, yoga, some of those things. Gardening for me, I love being outside. Obviously, if you're in a crowded area, you may not be able to enjoy that, but go out on your porch, walk out your front door, and just enjoy a little fresh air. Find something that helps you relax, helps you refocus your mind, and don't stay 24/7 looking at the news, because it will.
Yeah.
Keep yourself updated, but don't focus on it all the time.
It'll bring you down.
It'll bring you down.
Yeah.
It'll absolutely bring you down. Well, and what's interesting.
Well, what's your answer?
Well, and that's what I was getting into. Oh, you know me. I'll give you my. Let me pull the mic.
He's going to give us his thoughts.
It's interesting because I'm seeing in the fitness community, unfortunately, there have been some people trying to capitalize on this. And even outside of the fitness community, there have been people trying to capitalize on this crisis. And, keto and vegan and certain diets have been pushed, saying that it's going to cure the coronavirus or it's going to fix your symptoms or whatever. There's no basis to that. There's no truth to that. And I just think it's so important that at this point, yes, keeping positive and all I fully agree with everything that you all just said, but I think intentionally trying to spread kindness when there is I know that sounds so corny, but intentionally trying to spread kindness when there's so much negativity that everyone listening or watching this knows that they are seeing. And I think that that's so important, because it's one thing for us to listen to a governing body saying, what are we going to do? How are we going to get this better? Like, what are you guys going to do to fix this?
Right. What are they going to do?
What accountability?
What are you going to do?
What accountability are you going to take for yourself and the people around you? Coincidentally enough, a childhood friend, Heather Williams, she posted this the other day, and I was like, I have got to mention this. She said, if the school closures have you concerned about your child not being able to eat breakfast or lunch, let me know. I will help in any way that I can. A box of cereal, a gallon of milk, bread, peanut butter, and jelly. Just let me know. PM me, no judgment. And I just thought that snippet of kindness does so much for the next person that's next door panicking. So I think intentionally spreading that kindness is just huge. I really do.
Yeah, I agree with that.
Me over here with my whimsical, happy thoughts. Guys, this was awesome. I really appreciate y'all taking the time out of your busy schedules to doing this. Yeah. Glad we could catch y'all on. Now that you're not traveling as much, I'm glad we could catch you.
We're going to have to come back on a happier note sometime.
Absolutely.
Yes.
Well, and that's so coincidental. I almost touched my face again. It's so coincidental. We've been wanting to have the both of you on for quite some time, and it's just been schedule. That's been the only thing. Yeah. So look, there's some more good coming out of this coronavirus.
Yeah, next time, let's talk about a lighter subject.
Yes, please. Bringing people together. Again, we're gonna provide links down below about their private practice, and I'm gonna provide links down below, at least for the local area of these drive-through clinics and the process and the proper way to go about it. I'm not gonna give you a location where you just need to drive through. You got anything you want to wrap up, babe?
Yeah. Stop touching your face. Stop touching your faces.
I fully agree.
Wash your hands.
Yeah, that sounds like me. I remind Jerry 20 times a day. Stop touching your face. Yeah. Stop touching your face.
It's tough.
It's tough. Really tough.
It's tough.
And the more you focus on it, the more you want to do it.
Yeah.
Absolutely. My nose is itching so bad right now.
My chin is just so bad.
Yep.
Well, guys, thank you so much for tuning in. If you're new to this podcast, I truly appreciate you. Subscribe to it. We post an episode every Tuesday, and here lately, an episode every Friday. So thank you so much for the both of you coming on. This was awesome. And guys, we'll talk to you next week.
This has been the Better Than Yesterday Everyday Podcast. We want to thank you for listening and invite you to subscribe to the show as well. And follow Matt Lane Fitness on YouTube. Until next time, you don't have to be perfect. Just be better than yesterday every day.
Man, that was good.
What if your shirt has the coronavirus?
I have a doctor and nurse practitioner to help me, I guess.